for being here. Today's program, Treatment's Done, Now What? My name is Priscilla Andrews. I'm the clinical manager here at the Cancer Wellness Center. Just by way of introduction, I work with people through our counseling program with individuals, couples, and families. I've historically been involved with many of our different support groups, as well as our networking group for people with multiple myeloma. And then I do some of our educational programming here, including this program, which I was just saying to one of my colleagues, I think I've now been doing this program for over 10 years. So one of my interests along the way of my time being at the Cancer Wellness Center has been around survivorship and that transition into post-treatment, which is what we're going to be talking about here today. And I had mentioned a little earlier, if you just hopped on, that I'm going to have some polls that I'll be putting out there for you guys to respond to, both so you can kind of understand anonymously who else is here, but also for me to understand who else is here and what people's experiences have been. We are recording, so if you could just stay on mute. If you have questions, you can feel free to put those in the chat. So I'm going to go ahead and launch the first question here, just to understand, where people are at in treatment. I know that this program can appeal to people at various points in their cancer trajectory. And I see some of those results coming in, and once they come in, I'll go ahead and share that. And so as we get started, I'm going to share my screen. Okay. So hopefully everybody now sees the PowerPoint. So I have some of my objectives coming in here this morning. You guys have likely come in here with your own objectives. So hopefully there's a very close Venn diagram of overlap that I may not address everything you're hoping I would address, but at least I'm hoping that we've got some good coverage around what you're hoping to get out of today. So first off, one of the other programs that I do here at the center is to talk about the nervous system and how our nervous system has such a large role in shaping our experiences and our responses to things that we encounter. So I'm going to spend a little bit of time giving some basic information that provides some context to understanding what you may have and likely have been experiencing both during the diagnosis phase, the treatment phase, and now as you're entering the post-treatment phase. I'll also be talking about how do you transition into this new phase of having been diagnosed with cancer? I think that I always say, I think there's a better sort of cultural, societal understanding of going through a cancer diagnosis as far as diagnosis and treatment. Not perfect, but there's sort of a concept of that. And I think there's a lot of myths around entering into that post-treatment phase and can sometimes be a very confusing and destabilizing period of time after a very structured phase where the doctor's sort of giving you, okay, here's what you're doing, here's where to show up. So hopefully you'll also leave here with some things to think about as far as areas to look at for yourselves, to consider addressing or making changes in, as well as some more specific tips in those different areas. Now, I am hoping you guys will ask questions along the way. Like I said, there is that chat function there, and Lisa will be letting me know and reading off your questions. So even though I'm asking you guys to stay on mute, and that's mainly for your privacy's sake, please feel free to put things in the chat because I love hearing from people in the room and what they may want to hear more of from me along the way. So I know not everybody has responded, but I'm going to go ahead and share the results here. So you can kind of see who's here in the room with you. So I see there's about half of you who are more recently post-treatment, some of you who are in that 6 to 12 month, as well as some people joining us a little further out, as well as a few people who are anticipating their last treatment. And I have to say, I'm always so happy to see people who are in treatment but have chosen to come to this as they're anticipating finishing treatment, because one of the biggest pieces of feedback I consistently get from people after the program is, I wish I had seen your presentation before I finished treatment instead of after. Now, that doesn't mean those of you that have finished treatment are not going to benefit from today, but I'm always glad that to see people who are kind of being proactive and recognizing like, hey, this is going to be new and different, and maybe it would be helpful for me to get some orientation before I get to that point of treatment. So I want to talk about some words that are used here when it comes to the cancer experience. And just excuse me while I kind of try to orient myself to where my polls are. Oh, there we go. Sorry about that. Okay, so we've got this term survivor, and that term gets used a lot. And it was certainly when I first, and you're going to see a poll that pops up. There's 2 questions in that poll, so make sure to scroll down. When I first started here at the center, we used survivor, the term survivor, very liberally. And the term survivor sometimes means that phase post-treatment, but really survivor is like anyone from the day of diagnosis. That term can apply to survivor. Now, survivor is also used in like research literature to talk about people when there's, trying to speak to who is being studied in a research study as well. And then there's like the vernacular of how we use survivor. And just because we use a word doesn't mean that we like that word. And just because other people use that word to describe us doesn't mean that we use that word ourselves to describe ourselves. And what I have found over the years of doing this program is there are certainly people, and I'll share the poll in a moment because I think this is reflected in the responses that you guys are providing me here today. There's certainly people who really identify with that term survivor, that it has a positive connotation. I've been through something difficult here, and I've gotten through the arduous nature of this treatment and have made it kind of to the other side of that. And my doctor's saying, hey, it worked, and no evidence of disease, lots of hopefulness for the future. On the other hand, what I hear a lot from people is, I don't feel like that term describes my experience, in part because I'm still going through it. That the term survivor has this connotation of something that happened in the past that I'm supposed to be done with and moving on from. And I'm still managing, dealing, processing with what that experience was for me. I'm still dealing with side effects. I'm still dealing with the long-term impact of treatment. I'm still trying to get my mind around what I just went through and what it means for me mentally, emotionally, spiritually, my sense of identity. So there's a lot that goes into the cancer experience that doesn't just end on the day that you finish treatment, that many people don't feel like the term survivor adequately encapsulates, and that using the term survivor has this connotation that then sets up unrealistic expectations from others. Now, again, I'm going to share this poll, and you're going to see there are people who are in that 4 or 5 zone. And I think if a term is useful and is something you identify with, that's the purpose of it, is to have some way of communicating with other people. I think the challenge is that, as you can see, majority of you people, if you don't hate it, you at least feel kind of neutral about it or ambivalent about it. You might be accepting of other people using it, but that doesn't mean that you identify with it. And that's a challenge, right? Because then there's already this point of miscommunication where somebody is labeling you with a term that you yourself, it doesn't really reflect who you are or how you see yourself. Now, I do think there is another term, and I know it says survivorship in it, but I do actually think, or says survivor in it. I do think survivorship, I like the definition of it. I like it because it acknowledges that even though cancer is a medical diagnosis, right? It's something that happens in our body, that cancer, having a cancer diagnosis, is like Spider-Man shooting out a web. And there's all these tendrils of different parts of your experience that it can land on. Now, it might not have landed on all of these in your life. And I want to take a moment to acknowledge I have a second screen. So if you ever see me look over, it's because I'm looking at the screen that the PowerPoint is on. But it really speaks to the fact that it's all of you it was the whole of you that was impacted. Yes, it impacted your body. Yes, the treatment hopefully impacted those cancer cells, but it's not an exact science. So when you take chemo, it affects all your cells, right? So there's this whole body experience that you go through. It impacts emotionally how you feel. It impacts your sense of self. It can disrupt the relationships in your life. It has a financial impact. It can have implications in your professional life or your work life, right? I hope you see where I'm going with this, that it cancer spreads its wings and touches things in your life that other diagnoses and other illnesses don't necessarily have an impact on. In part because a cancer diagnosis, it's not like being diagnosed with the flu. It's not even like being necessarily diagnosed with COVID, right? Where it's this time limit thing and it lasts for several days, or maybe it lasts for a couple weeks, and then it's done and you move forward and you're kind of back to where you were before. No, it's a much bigger experience than that. Um, and so that's why I like to bring in like both the expectations we have for ourselves, as well as thinking about that piece about your nervous system and how we come pre-programmed to respond to things. And that pre-programming, that wiring may not always meet up with what we expected to have happen. And I think whenever the reality is separate from the expectation, that is a challenge. Now, of course, sometimes expectations far exceed what we expected, and that's wonderful. But what I find more typically is there's a lot of different areas that people have expectations around as they transition into post-treatment that are not necessarily met. And then that causes stress, distress. It causes anxiety about what that means. It causes anxiety about what it says about oneself. So there's lots of different expectations that one can have. And I'm going to launch another poll here, right? These ideas that I don't know if they universally do it, but there was a point in time where when you finished chemo, you could ring a bell, right? And, I've worked with many people who, when they were anticipating the end of treatment, we're going to ring the bell. We're going to go out for everybody in my family's going to go out for dinner. We're going to take the trip. We're going to express through celebration, the fact that I finished this thing that was so hard, that was this sort of finish line, this goal I was trying to get to. And I want to acknowledge you're able to pick more than one of these expectations. You don't have to pick one. If you identify with more than one, you can go ahead and click multiple of them. Now, certainly celebration is a part of it. I'm going to skip ahead to like feeling grateful. There can be a lot of gratitude about I made it through this. The doctor is saying the treatment was successful. I'm grateful for the people that showed up for me. I'm grateful for my healthcare team. I'm grateful for my access to care. That's just not the whole story. And a lot of times when we talk about the celebration and feeling grateful, that's the beginning, middle, and end of it. That's how you're supposed to be feeling. Alongside of, I'm going to feel well physically and mentally. I'm going to go right back to how I was before. I'm going to pick up where I left off. I'm going to pick up the things I did before. I'm going to feel like the same person I was before. And part of that is going to be, I'm not going to need support anymore because this thing is done, right? And sometimes these are expectations we have for ourselves. Sometimes they're expectations that get communicated to us by the people in our life. Um, Sometimes those expectations get communicated to us very clearly. Oh, aren't you so excited? You must be so happy and grateful to be done with treatment. Sometimes those expectations are communicated a little more implicitly, right? The adult child with children of their own that comes to you the week after treatment and says, great, this means you can take the kids for the weekend, right? Right? The expectation being you're going to feel up to taking the kids, you're going to want to take the kids, you're going to feel like your stress level is at a level of being up for taking the kids, right? There's a lot of expectation that gets squished into that one request that doesn't express all those things one by one, but kind of rolls it up in a package. And you yourself, you may feel other people's expectations as a reflection of your own expectations. The other thing I hear from people frequently is the people in my life are more compassionate to me. They expect they have a different expectation than I do of myself. I expect myself to get back to normal. I expect myself to go back to work and perform at the same level. I expect myself to want to do the same things that I did before. And so again, when that expectation is not met, right? That's now we've got this gap that we have to contend with and that we're going to have understandably a mental, emotional response to. I'm going to share these responses here so that you can see, right? Like, and some of them are more, some of you are endorsing some of them more than others, but you can see for yourself, like part of I want to do this is if you check some of these boxes, nobody was the only person that checked the box. You're not alone in this. I think post-treatment can sometimes be a very isolating experience because what I find is some people can have a tendency to internalize the fact that they're not meeting those expectations. And what I mean by internalize it is I'm not meeting those expectations, so it means there's something wrong with me, which it's to me a very painful thought. There's something wrong with me, when really there's not. And that's when where our nervous system comes into play. And I love this because I liken the end of treatment where you are going to the doctor on a regular basis. You are seeing nurses, you are seeing the check-in staff, you are seeing the lab people, you're seeing all those people that you encounter on a regular basis that are telling you what to do, where to be, when to be there, answering your questions, assuaging your anxieties, and then the oncologist, the nurse says, you're all done. Go with God. Not quite. I'm being a little hyperbolic here, but I always liken it to like you're getting like a baby bird being pushed out of the nest, saying, fly away, and I'll see you in 3 months or I'll see you in 6 months. After seeing these people, maybe every week, maybe a couple times a week, right? That's a lot to pull out from somebody, especially when for some people treatment, even as some people don't like treatment, don't like the side effects of treatment. There's also something comforting about that. I'm doing something very active to treat the cancer, get rid of the cancer, make sure the cancer doesn't come back. So now how am I going to know I'm going to be okay? How am I going to be sure that that sensation or that symptom I'm having isn't a sign that the cancer's back? And now you're having to manage that on your own without, okay, I'm going to be in there next Tuesday and I can ask Nurse Jackie, what is this all about? And there is this woman whose name is Jimmy Holland. She was sort of at the forefront of psycho-oncology, which is sort of the study in psychology of the mental, emotional, psychological impact of a cancer diagnosis. And she had this phrase, she said, when you're done with treatment and the doctor gives you all clear, you're disease free, but you're not free of disease, right? You're still making sense of, coping with the impact, not only of the diagnosis, but of its treatment and all of the other areas of your life that it may have impacted. So this is where I like to talk about nervous system stuff. So we come pre-wired with a nervous system, that a part of our nervous system, our autonomic nervous system, which is wired for our survival. And it has a response pattern that we come pre-wired to have. And there was this guy, Hans Selye, back in the mid 1900s, like 1950s, he started researching like stress response. And he came up with this sort of framework of understanding how we respond in crises that has been built on since the time he came up with it, but it sort of gives a nice basic understanding, a foundational understanding of how we respond in crisis. And I think we could all agree that cancer is a crisis. It's a manageable crisis, but it's a crisis nonetheless. And all of you here, you might take a moment to think, like, was this the biggest crisis of my life? Because for many individuals, cancer is the biggest crisis they've experienced, other than maybe the birth of their children, whether as a father or a biological mother. That might be the first time that they were really in the hospital or engaged in the healthcare system that much. Um, for other people, maybe you've had other crises, maybe even had other medical crises. I had a client once who had a very serious blood clotting disorder. And yes, the cancer was stressful and challenging and scary, but that blood clotting disorder, that took precedence. That was a bigger crisis for her, right? So you can think like, yeah, and think about like how you responded, if it was the biggest crisis, how you responded, maybe realizing, oh yeah, there was this other thing that kind of took precedence for me as far as crises go. Okay, so here's what he discovered. He discovered first off is that we all have kind of our own internal resistance to stress. So that's like, how much can we absorb the wear and tear of day-to-day life? And we can think of some people who have a very high resistance to stress, who just, things, they're like feathers on a duck. Things just sort of, water rolls off their back. And then you can think of people, I call it people who get cancer of the hangnail. Everything is an emergency, right? But for the sake of our conversation, we're going to just say we just have this kind of middle of the ground, average bell curve resistance to stress. That was one thing Selye discovered. The second thing he discovered was that in the immediacy of a crisis, that crisis actually causes our resistance to the stressors to be compromised. So what does that mean? That means if that line is our resistance to stress and it dips down, that means we're going to start showing some of our stress response signs, some of our signs of being under stress. And he called that the alarm phase. Now, you can see here, there are four kind of categories that our signs of stress can show up in. And I always think of, like, for those of you that remember when you'd have like the big stereo in the cabinet and you'd have a tuner with all the knobs, if you think about all these signs of stress as being knobs, and so some of these signs you may really identify with. Some of these signs you have to be really stressed out for them to show up. Some of them maybe don't show up very much, right? So everybody's going to have their own pattern, their own profile of how stress displays itself for you. And it's common. It is not just common, but it would be normal to have signs of stress show up in all four of these quadrants. So in the immediacy, and remember, you'll get the slides. So if I didn't leave that up long enough, you're going to have it printed out, or at least in a PDF for you to print out. So in the immediacy, those signs of stress are going to show up, right? You know, feeling your mind racing, feeling blank, can't think straight, feeling anxious, being more tearful, maybe can't sit still, maybe like frozen in space, feeling your heart, right? Maybe that was when you first heard that you had cancer. Maybe that was throughout the treatment planning phase or the testing phase, right? But it would be normal to be having some of those signs of stress. Then what happens? Then we have these stress hormones, adrenaline, cortisol, that our nervous system says, hey, body, start sending out these stress hormones because this person's in a crisis and they need to handle whatever's in front of them. And that's what Sallier described as the resistance phase. Now, this system of response, he called this the general adaptation syndrome. Okay. This response pattern is really intended for like short-term response, right? I always use the example of like, you get in a fender bender, somebody rear ends you, your heart's racing, oh my God, like, is my car okay? Am I okay? You get out, you kind of like a little freaked out for a while, and then you're like, okay, what do I need to get? I need to get my insurance card. I need to go talk to the person. We got to talk to the police. Short term, is everybody okay? We're okay. And then we come back to our typical resistance to stress, our stress resistance level. Cancer is not a time limited thing, right? It goes on for weeks and months. It can go on for over a year. And so what happens, right? You get diagnosed, you go through treatment planning, maybe you have surgery, maybe you have chemo, radiation, right? It's this extended period of time. And at a certain point of time, all of our nervous systems are going to become exhausted. The well is going to metaphorically run dry. And we're not going to be able to stay in that state of heightened resistance, because even though that looks like, okay, great, high resistance to stress, that is intended, that amplified resistance to stress is intended for short periods of time, not to be going on and on and on. So then what happens is we enter what's called the exhaustion phase. Now, if you see that curve, what you're going to notice is that stress resistance is lower than typical. So what does that mean? Well, the way it shows up for me in the counseling room is, I don't know what's wrong with me, but every little thing bothers me. I don't know what's wrong with me, but I was never a crier and I cry at the drop of a hat. I don't know what's wrong with me. I keep losing my temper with my kids. I don't know what's wrong with me. I'm super irritable. I don't know what's wrong with me. I can't stop thinking about XYZ. I don't know what's wrong with me. I can't think straight. I can't, right? There's all these different ways that stress shows up, right? I'm going to back up. These different signs of stress. And so what happens is in that exhaustion phase, because you're typically used to this resistance of stress up here, and it is in this sort of recovery zone, it's been exhausted. So now your resistance to stress is down here. Things that used to not bother you, things that used to not trigger a stress response, things that you could absorb are now you're going to be more responsive to, because that resistance level is compromised by everything that you've been through. Okay. Now the good news is that we can do things to heal and recover from that physically. There are strategies that we can take to help us put ourselves in better footing, to bring our resistance to stress back where it typically can be. There are things that we can do, strategies, coping strategies that we can utilize that I'm going to talk about in a moment, that we can utilize that also maybe when we do get in that kind of activated resistant state again, can help us return back to our baseline. So this is not a like forever thing to be in the state of exhaustion, but this is to say that if you relate, I'm going to launch another poll, if you relate to being in that state of exhaustion, you're in good company. Now, I will also say this is not a like one-to-one. You're in alarm phase when you're diagnosed, you're in resistance when you're in treatment, and when you go into post-treatment, you're in exhaustion. So I don't want to communicate that. And because sometimes what can happen too, we can cycle in and out of this. And what I find oftentimes is that during treatment and even following treatment, people ping pong back and forth between being in this state of like mobilization and kind of internal, like, what do I need to take care of, and exhaustion. And that is hard to get back to that baseline because you've been in this highly stressful period of time. And I will give you a sneak preview to say the majority of people that are answering the poll, I'm going to leave it up there for a few more minutes just to see who else may respond. A majority of you are saying, I'm in the exhaustion phase. I can identify with what you're saying there, Priscilla. So when we're in that phase where our nervous system it has been in this sort of survival state to help us meet the demands. And that exhaustion phase is actually still a survival state. There are lots of emotions that can show up. And emotions, feelings, are words that we have developed, language we've developed to describe a physiological response in our body. And there's lots of feelings that are normal to have. And it's also normal to have like a mixture of these feelings, which I think is very confusing. I find it very confusing, right? Like some of them are better understood, like bittersweet, right? Something, you're dropping your kid off to college and you're excited for them, but you're sad for you. And it's this mix of emotions, right? That's something we can kind of understand. But the idea of I can be like so happy and grateful to be done with treatment and so scared about what's going to happen next, and those can coexist. There's a whole movie about it. If any of you have not seen Inside Out, I don't know a therapist who doesn't love that movie. And that's what that movie's about, right? If any of you have seen it, there's these different emotions. And when a memory gets encoded in the movie, the memory is like this ball and it's one color, right? It's one emotion. But at the end of the movie, what does she have? She has these encoded memories that are more than one color because our experiences have more than one color. And so you can see here that, and I'm just sharing the stress response poll so everybody can see that where other people in the room are, right? There's this assortment of signs of stress people experience, as well as, again, if you look at what part of that model that I just went through, do you identify with? No, notice that there's none of those three phases that only one person answered, right? There's somebody out there that is in that same state that you're finding yourself in, which tells me, hey, it's not just you. There's nothing wrong with you. This is how your body, this is how your nervous system is designed. But when you look through these feelings, some of them, I think there is a more of an imprint or an expectation. Yeah, maybe I'll feel anxious, I'll feel stressed out. I think some of them are confusing or surprising. That's why that's up there. Like maybe not realizing how isolated you might feel or how vulnerable you might feel. Numb is a feeling too. Not feeling anything is also your body telling you something really important, which is saying, I am so overwhelmed, I can't feel anything right now. That's the most protective place for me to be in, right? I'm just kind of blank inside. Maybe the things I normally do, I'm not motivated to do them, or I'm not enjoying them in the same way. Now, if that goes on for a really extended period, we have a word for that, and that's called depression. But to be in this place of numbness intermittently, that is common as well. And I'm going to take a moment. I love a good poll, to just launch another poll here. Now you can pick more than one option here. So I invite you all to check off all of the emotions that you may have been experiencing as you've been in this post-treatment phase, or even if you're those handful of people that are still in treatment, applies to you as well, right? It's not a one-note experience. Now, and I do want to say, people do feel relieved. People do feel grateful. It's not that those more like positive emotions as a therapist, I don't like saying negative or positive emotions, but those more positive connotation emotions don't exist. They just coexist with all of these other experiences as well. Um, you know, when it comes to a cancer diagnosis, there's so many major life experiences that we go through that we would never expect somebody to be exactly the same on the other side of it. Somebody doesn't have a child and you expect them to be the same person. Somebody doesn't go through a divorce and you expect them to be the same person. Somebody doesn't go through a career change and you expect them to be exactly the same person, right? There's all these experiences that we have, and it's sort of built in the expectation of it's going to leave us feeling different, looking at things through a different lens. And yet with a cancer diagnosis, there's often this expectation that I'm going to, or maybe it gets communicated to you by from other people, that things are going to just be status quo, and I'm going to have went through months and months or even years of treatment that may have changed how my body works, even if it's temporarily, may have changed how my body looks temporarily or permanently, and I'm just going to be the same exact person. And actually um this cartoon came up in one of my presentations years ago. I was talking about this concept, and the equivalent of one of you was like, oh my God, there's this cartoon. And I so identified with it because I feel like I'm seeing the people in my life and they're like surprised that I'm not the exact same person I was after I went through all of this, but I feel different and they expect me to show up in the exact same way. Right? So now we've got to do some translating. We've got to make sense of it for ourselves. And now we're trying to explain to other people in our life. And I see I see a pair of people here on my screen. And perhaps both of you are dealing with a cancer diagnosis. Maybe one of you is the partner or the loved one of the person with the diagnosis. And I'm always so pleased when people who have a partner or a loved one come to this program, because to me it shows care, and also shows an openness to learn about and be open-minded about what could be going on for somebody I care deeply about that is not what I thought was going to happen. Because that is something that I see frequently. I do couples therapy, and sometimes it is a point of divergence where, not all the time, but the person with the diagnosis is still struggling with all of the longer term side effects, the psychological impact of the diagnosis, and trying to grapple with all of that. And the partner without the diagnosis is like, so we're going to go back to the way things were, right? I want my partner back. I want to do the things we did before. And it doesn't always, it's not a light switch. Doesn't mean it doesn't move in that direction, but it's not a light switch. Lisa, how are we doing with the chat? Or I'm assuming we're good with that. I just want to pause here for a moment.
Yep, we are good. We have some questions that we could answer at the end. So nothing related to immediate responses needed.
Great, thank you very much. Before we move on here, I want to share this poll. And again, first off, thank you so much. I'm so glad so many of you have been responding to the poll. I'll tell you what I noticed. If you don't notice it, nobody didn't answer any of them, and there was none of these that only one person answered. So again, reinforcing that idea of, even if you are right now alone in your house as you're watching this, you are not alone. There's somebody else who can relate to some part of the experience that you're having. And I want to highlight, a majority of people feel grateful. And maybe the grateful and relief people overlap, but maybe not. But there's this relief and gratitude people feel, and yet all of these other emotions are there, including that sense of vulnerability, right? Like, what's going to happen next? How am I going to know I'm okay? And I'm going to talk about that in a few moments here. So here's a tip. Let's talk about a coping strategy here, is patience. Now, I always say that if I could bottle patience, I would not be here, and I'd be making the round at baby showers and selling it, and I'd be super rich if I could sell patients. Or maybe I'd be like outside of like the daycare centers and selling it to parents who have a toddler. If only it were that easy. So I do want to acknowledge that um, preaching patience words are easy, but implementation and taking steps to increase and cultivate patience with yourself and with others, that is more of an active process. Now, the good thing is that there are some things that we can do that can help us cultivate patience. Um, One thing is recognizing there are going to be good and bad days, and sometimes they exist within the same day. Um, One rubric that I always keep in mind is, and this may not apply to everybody depending on what your course of treatment was. For every round of chemo, for every chemo treatment, expect a month of recovery time, right? That means if you had 12 rounds of chemo, that's about a year of recovery. Now, what does that mean? That means the graph is going in an upward direction, bumps in the road, and that you're gradually returning to more of what your baseline would have been physically before the treatment. Well, also I want to pit stop to acknowledge, like, some people, sometimes there's longer term side effects. Sometimes your body is different and it's not going to go back to the way it was. You've had a mastectomy, with or without reconstruction. Maybe you have a colostomy bag. Right? Maybe you had prostate cancer and you've lost function, and your urinary functioning is different, right? So some things may be more permanent changes. And that's why if you look at the fourth one down the row, and I'll backtrack here, is giving yourself permission to grieve. Grieve the changes in your body, grieve the loss of time. Some people maybe felt more carefree before the diagnosis, and now they think more about their health. It's introduced thoughts of their mortality that were really not a part of their existence or front of mind before. So, grief is really a natural human response to losing something. We associate most frequently with losing a person or a pet, but grief is what happens when something that was there isn't there anymore. And allowing ourselves to grieve and to acknowledge the loss and acknowledge those feelings of sadness or anger or frustration is part of the path forward, rather than trying to say, I'm okay, I'm okay, I'm okay, I'm okay. It doesn't matter. Because it'd be understandable if it matters. I also like to talk about, I want to talk about for a second of like where you put your expectations of yourself and having realistic goals for yourself. I guess I'm working backwards from grief. Um, Most people, what they do is they say, um, here's where I was before, and I want to get back up there. And so now my point of comparison is how I functioned before the diagnosis and treatment. Now, what does that show? What happens? I am always going uphill. I am always going uphill. I'm not seeing any of the progress I've made. All I'm seeing is how I am falling short of what I want to achieve. Right? What's your reference point? Are you going back to the like, okay, I used to go to the gym 5 days a week for an hour and a half, and I like that's where I want to get to. Great, good to have goals. But if that's your point of comparison and you go to the gym and walk the track for 20 minutes a couple times a week, what are you going to say to yourself? I'm failing. I'm not even there. Look at, I used to go to the gym for an hour and a half, 5 days a week. I was in shape, blah, 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 blah. Right? Very easy to be hard on yourself in that situation. What I always preach is take your worst day and make that your point of comparison. What was the worst day that you felt physically? Because that is going to allow you to unveil the progress that you made. I had a client years ago who was a big, like, she liked to hike and walk. And she came in to me lamenting the fact that she went to go and get her mail, like at the mailbox. She lived like in an apartment complex, and she couldn't even make it there. And, you know, really sad about the fact that, like, what is wrong? I post treatment. I don't feel like I'm gaining any ground. And I said, well, what was your worst day? And she said, well, my worst day was the day that I got up and I took a shower and I had to go back to bed. I was like, did you make it to the mailbox that day? No. He's like, okay, that's our marker now. That's our marker of progress. Did you make it to the mailbox? Did you make it to the end of your driveway? Where did you make it? So now you're able to see, okay, last week I couldn't make it to the mailbox. This week I did. Last week I couldn't make it down. I couldn't make it around the block. This time I did. Right? So thinking about how to set your frame of mind to set yourself up to see the gradual progress that you're making. Um, you know, I think that that goes along with doing things at your own pace, right? What am I able to do that is going to give me a feeling of success and be the right fit of stretching what I feel physically capable of doing, what I feel emotionally, psychologically capable of doing. We want to stretch and not strain, right? Because what happens if we exercise, there's the difference between I'm sore, but this is a metaphor. There's a difference between when we exercise and we're sore, but it's kind of that good sore, like, okay, we're like building muscle. And when we strain ourselves and we throw our back out or we've got bursitis in our shoulder, right? Metaphorically, we want to be in that stretch where we feel like, over time, we're expanding what we feel our zone of comfort is and what we can do. We don't want to push ourselves to a place where now we feel bad and we feel like we've taken a step back rather than the steps that we've taken forward. The other thing too, and I'm going to share another poll here, is you're going to get mixed reactions from your family and friends. There are going to be the people that get it or get at least parts of it. And then there's going to be the people who just don't have a clue. And you've probably already encountered those people who you're like, what is this person expecting of me? Don't they understand what I just went through, right? And some people are lucky enough to be surrounded by individuals who are very compassionate. Maybe you might have people in your life who've went through their own medical crisis or even went through a cancer diagnosis. There's a lot of camaraderie and understanding there. And then I know, and I'm seeing the results right now, that on balance, the majority of you, there's at least one person in your life that just does not have realistic expectations of you. And maybe that unrealistic expectation is about what you're physically going to be able to do. Maybe it's unrealistic expectation of, being positive and excited about being done with treatment and getting back at it, right? There's a whole range of what people can be expecting that is just not the reality. And so that sort of leaves you in a place of, like, first off, recognizing you are not alone. And I'm going to share this here. You are not alone if that's what you've experienced. If you're experiencing that person or those people that you're like, what are they, do they not know what I just went through? Is now there's a process that you have to go through of, like, what do I want to do about it? Is this about, like, cutting the chaff from the wheat? And there's some people where I'm like, that relationship just is not important to me. And it's taking me more energy to figure out how to navigate it. And I just need to distance myself right now because I just don't have the extra energy for that relationship. Is it somebody that is really important to you, or maybe somebody like you can't avoid, like a member of your family, maybe a coworker, maybe even a boss, where, like, now we got to think about, like, how can I advocate for myself by educating them about, hey, I get that you think X, Y, or Z, but I want you to know where I'm at. And now you've come to this program, so you can send them the link for the YouTube after this, or you can say, well, the clinical manager at the Cancer Wellness Center told me that what I'm going through is normal. So I want to help you have realistic expectations for me. Now, it's easy for me to talk about that. That's a much harder decision to implement in reality, is to decide, who do I want to maybe have some of those, what can feel like tougher conversations with, to say, I need you to slow your roll as far as what you think I want to do or I'm up to doing, or how you think I should be reacting, because it's not really where I'm at. And I need you to stop putting pressure on me. But as you can see, 63% of you said, yes, there's somebody in my life that uh, does not seem to really understand what is realistic for me right now. Okay, now let's talk about being empowered, right? So empowerment, big concept, but I want to break it down into some like actual steps, actual things you can do. Number one, be informed. Okay. Talk to your doctor. Talk to your doctor about the information they shared with you when you were first diagnosed, and they said some words and you really couldn't process them. Because if you're like, I know the doctor told me what type of cancer, I know the doctor told me why this treatment, I cannot for the life of me remember what they said. That is because when we receive information that's too much, too fast, too soon, our brain does not encode it, does not process it in our prefrontal cortex, which is where our higher level thinking is. When we're in that state of too much, too fast, too soon, like hearing you have cancer, whatever comes next, our brain is in a survival state. And it would be more understandable than not if you did not process all of that information to be able to understand it from a higher level thinking perspective. So post-treatment is um, a wonderful time. You're like the guys on ESPN on Monday morning that are talking about the football games on Sunday. That's what you're doing with your doctor. That's what you're doing with your healthcare team. Let's sit down. Help me understand what just went on there. And you mentioned that term survivorship. So survivorship planning is something that that you have the right to go through the process of with your healthcare team, whether it's with your specific healthcare team, or maybe there's a program at your hospital that you go to where they go over all of your information. And it's this sort of three-part process. We want to collect all of the information that you had about your diagnosis. You want to figure out, okay, what do I need to do now? What kind of surveillance am I going to have? Um, and you also want to ask questions, right? Who do I see for what? Am I supposed to keep calling you? Or are you expecting me to start going to my internal medicine doctor or my gynecologist or my primary care doctor? Because that can sometimes be an uncomfortable shift, because you've been kind of maybe often going to your oncologist for things, and then you reach out to your oncologist and you wait for their reply, and you're worried and you're waiting for the reply. And then what they say is, oh, I can't, you go to the dermatologist, go to your gynecologist. I can't help you with that anymore. I mean, maybe in more gentle language, but they say you got to go to your other doctor. So it's helpful to kind of clarify whatever information you need. Help me understand, why did you choose the treatment? Why this, not that, right? Um, Sometimes people find it helpful to talk about prognosis. What's my risk of recurrence? Um, Next level of that, sometimes people find it helpful, like, what symptoms would you be looking for? What are you looking at? What should I be monitoring and letting you know? Sometimes that's helpful because it's normal to like everything that you experience in your body being triggering and make you worry the cancer's back. I have a headache. Oh my God. Is it brain mets? Is it in my brain? Right. Oh my God, my stomach's bothering me. What's going on? Right. That's, of course, because your body is like responding. It's been in the state of alert. It'd be normal for your body, for any signals your body's sending you, to now be worrisome. So it can be helpful sometimes to talk to your doctor about, okay, this category of stuff is very highly unlikely to be something that shows up as a sign that something's going on with my cancer diagnosis. So now I have a filter I can put those symptoms through. As well as some people, sometimes it's helpful. Okay, what would we do if it came back? So that it takes away some of that mystery and some of that filling in the blanks. I know those conversations are not for everybody. So I'm not saying necessarily to have those conversations. But if you're somebody who finds information to be reassuring, if information helps you feel empowered and have a sense of control, have those conversations with your healthcare team. The other thing that is helpful is this, I like this acronym, Take Part. So that's really talking about a way of engaging with your healthcare team when you sit down to talk to them. Now, most people do the P, and the A, and they typically do the T, right? They think about what they want to talk to their doctor about. Side note, I always recommend type that list up, go into the appointment, have a list for yourself, have a list for the doctor, because that's your agenda, and you want them to know what your agenda is. They have their own agenda, you have your own agenda, and you should leave there either having your agenda addressed or knowing how they're going to address your agenda after they leave the room, right? Asking those questions. The thing that people are often surprised about or go on, think about that, is repeat back what you heard. If you hear something, the doctor, you say, okay, so what I heard is I should meet with you every 6 months and I should meet with the surgeon every 6 months. But what you want me to do is schedule those overlapping. So I'm seeing somebody every 3 months. Is that accurate? So what I hear you saying is the reason you chose this treatment for me was because of the markers in my tumor, and this treatment was the one that was going to best fit my tumor. That's why I had a different treatment than my friend who had breast cancer. Is that accurate? It allows you to leave there knowing that how you were understanding that information was accurate to what they were trying to communicate. It allows your doctor to correct any misunderstanding. And sometimes it allows the doctor to kind of yes and you, like maybe in you repeating it back, they realize they left off something important. So I think that's a really valuable thing to do to make sure that you're on that same page, because we're very creative as humans by nature. And so we can leave there and we're great at filling in the holes. Some of you may even be like, oh yeah, that time I left and the doctor said something and my head was spinning. And then when I went back there and I said, well, so is, X, Y, or Z, this is what was, I'm worried about this. And they're like, that doesn't apply to you. You're like, oh. So that clarification process can be really meaningful. And I'm going to throw up another poll that has several questions that just talk about communication and post-treatment care planning. You'll notice that the first question you can answer, you can pick multiple of those choices. So another way for empowerment is kind of two-part. And it's really about that mind-body awareness and mind-body connection. Because if we go back to what I was talking about before, right, is our nervous system plays a huge role, a primary role in how we respond to things, physically, how we respond to things mentally, how we respond to things emotionally. Right? Emotions are just words for a physiological response in our body. So if we work from the neck down, it can be helpful in helping our body recover from the stress response that our body naturally did because of going through a cancer diagnosis. Now, why am I talking about relaxation techniques? I've already said there's a part of our nervous system called our autonomic nervous system. And that part of our nervous system has lots of different jobs. It regulates our heart rate, it regulates our respiration, it regulates our body temperature, it regulates our immune system functioning, it regulates our digestion. I think of it kind of as like the HVAC system. It also is our surveillance system. It's the security system in our body that is constantly taking in information of if I'm safe or not. Is there a danger or not? I think we could all agree hearing the words you have cancer are pretty dangerous, right? And so that when we encounter a danger, our nervous system is going to respond in a survival response to try to keep us as safe as possible, right? That's where we get that resistance phase and that exhaustion phase, right? That's what that is. That's our body going into survival response. Now, optimal healing occurs when we're in homeostasis. Homeostasis just means that we're getting enough information, our nervous system's getting enough information to tell us, to tell our system that we're safe enough. It doesn't mean everything is perfect, but it just means there's enough cues of safety to outweigh the cues of danger. Now, the challenge is that in our body, we have nerves that go from our brain to our body, and we have nerves that go from our body to our brain. 20% of our nerves go from our brain to our body. 80% of our nerves go from our body to our brain. So when we're having that stress response that happens in our body, that happens neck down, right? Our body gets into this activated state, and then our nervous system sends messages up to our brain, and our brain learns that our body is in this stress response state and says, uh-oh, Priscilla must be in danger. Keep that going. And it can become this cycle where we keep our nervous system kind of keeps our body in this activated state, in this survival state, because messages are coming from our body saying we're not safe. When we do relaxation techniques, okay, what they do is they help to stop that survival state response. They help diffuse and pause it. Because when we do relaxation techniques, things like yoga, meditation, Tai Chi, guided imagery, progressive muscle relaxation, they elicit a relaxation response in our body. And so then our body, through those 80% of nerves in our system, sends a message up to our brain and says, oh, I think Priscilla's like, I think she's okay enough right now. I think we can go back to that homeostasis state where heart rate's regular, respiration's regular, immune system is optimal, right? So there's a powerful element that relaxation techniques can play in helping us recover physically from being in a stressful situation. And when our body is in a more relaxed state, is in that homeostasis, our prefrontal cortex, the part of our brain that is higher level thinking, is more fully online. We're in our kind of optimal functioning mentally as well. It helps calm our system emotionally as well. So lots of wonderful effects for overall well-being that relaxation techniques can have following a crisis like a cancer diagnosis. And I'm just going to go ahead and share the survivorship care planning results, just so you can kind of take a look to see, okay, oh, look, there's people that can identify with. Okay, so there's lots of different relaxation things we can do for relaxation. I think of like, and I think relaxation techniques is kind of, I think of it as like one category of stress management strategies. Relaxation techniques are really about focusing on eliciting that relaxation response in our body. Yoga, Tai Chi, meditation, right? Creative outlets, getting into like a flow state where you're really absorbed in what you're doing can also elicit the relaxation response. Social connection, the part of our brain that is responsible, that nervous system part that's responsible for picking up safety and danger cues, is also very responsive to other people's nervous systems. So you can think about people that after you're with them, you just feel better after being with them. Like that social connection is so meaningful to help our body recover. I call those I call the like relaxation techniques, I call them explicit stress management, because we are very intentionally trying to elicit a relaxation response. Then we have these things, I call them like implicit stress reduction techniques. implicit stress management techniques, things we do that just make us feel better, but maybe we're not thinking about them helping us let go of our tension. Maybe we're not intentionally doing it to like be in the moment, but that's what um, the outcome is. You know, things like spending time with a friend, watching a funny movie, going for a bike ride. Well, I guess that's not the time of year for a bike ride, but you know, these things that are just sort of a part of our routine that make us feel good, help us manage our general stress level. And a lot of times those implicit stress management things that we do, we don't think of them as stress management. And they also often get put on hold during a cancer diagnosis because of all of the other demands. So thinking about what are the things that used to be a part of my routine that were just things I did that I enjoyed, things that like after I did them, I just felt better. If you haven't done those in a while, thinking about picking them up again. Now, I'm going to put up, I have another poll. I love a good poll here. So you'll see, you know, a lot of people that I see, stress management. Normally when I would do this in person and I say, hey, who here had stress management routine before the diagnosis? And I'd get like one person that raised their hand and then everybody would avoid eye contact with me. Because people don't often have this like very routine stress management um, uh, process that they do on a regular basis. Sometimes people implement it in their life during treatment, and sometimes it's after treatment that people say, I want to be healthier overall. I want to reduce the stress in my life. And so I'm going to start taking on and doing some more stress management um, activities. You'll also see at the bottom of the poll, we'll give you an idea of some of the things that fall into that implicit stress management category. Um, Maintaining healthy eating habits, getting a good night's sleep, being in nature, participating in spiritual practices, being with a pet. Like these are all things that help us reduce our stress response. They're just not that explicit relaxation technique like yoga and meditation, etc. Now, alongside of that mind-body technique is also physical activity. I'm not talking about training for an Ironman, right? What research has found is that elevating your heart rate 5 days a week for a half an hour has benefits to lowering your risk of recurrence. So that means like going for a brisk walk, right? We're not talking about the intensity of doing a step class. We're not talking even about going to Zumba. We're talking about something that's going to get our heart above resting rate for that half hour. And there's lots of benefits to physical activity, right? It helps with quality of life. It actually reduces fatigue. Um, and it also, because in part it improves sleep quality. I know that can feel a little counterintuitive, like if you're feeling really tired, the idea of doing physical activity, you're like, I can't drag myself out of bed, I can't get myself off the couch. And certainly like there is some fatigue where it's like to the bone, you're not going to push yourself, self-compassion, give yourself grace. But if you're hedging and you're like, keep in mind that you may actually feel better as far as your energy level goes if you get up and do a little bit of physical activity. Psychologically, we know that physical activity also helps reduce distress and symptoms related to depression and anxiety. So really wonderful, positive outcome, positive benefit from a both physical standpoint and a psychological standpoint to be physically active. Now, sometimes we need a little guidance as far as how to go about doing that. You can see here, there's lots of opportunities that we have at the center. Some of them are hybrid, so you can come in or do them from home. Most of our activities are available on at least online, if not in person. You'll get this in the slideshow when I send it to you. I'm sure if you messaged Lisa and said, hey, can you get me a copy of the December program guide so I can see what you guys offer week to week? Because all of these are things we offer on a weekly basis. I am positive Lisa would be more than happy to forward that along to you. Okay. So finding what's in your control. This is another way to be empowered. Now, what is in your control? This can be kind of confusing. Um, you know, I I think especially like nutrition, healthy lifestyle changes is something people often go to. And like I have like in the years that I've been here, cycled through the number of things where it can be like, coffee's bad for you. No, coffee's good for you. Do the asparagus diet. Don't do the asparagus diet. So it can kind of be hard from that perspective to wade through, okay, what should I do for myself to feel good that I'm doing what I can, right? We have something called a locus of control, meaning where is the control centered? Is it outside of me or do I have control? And cancer takes a lot of control away from you because you didn't choose to have cancer. And if you were in our healthcare system, you probably didn't have a lot of control over, maybe you were offered some treatment options, but you probably weren't offered a whole lot of control of how frequently you had treatment, when you had treatment, right? That external locus of control. And what we want to do is do things that help us identify what we inside of ourselves can control. So, what are those things? Setting a daily schedule. Maybe your routine got thrown off during treatment, likely it did. Even if maybe you're especially if you're not back to work or if you're retired, getting on a daily schedule of like, I get up at the same time of day, I shower at the same time of day. Maybe it's having a weekly routine. Every Wednesday I meet so and so for coffee, right? That can actually be really helpful at increasing your sense of control, that internal locus of control. Making healthy lifestyle changes benefit both mentally of making that. Look at what I'm doing to help optimize my well-being. Also, obviously, physical benefits to that, increasing nutrition, becoming more physically active, decreasing unhealthy habits like drinking or smoking. Problem solve. Sometimes we have stressors we can do something about, right? If I keep taking the same route to work every day and it's taking me 45 minutes and I keep getting in traffic and I'm tearing my hair out, if I can find a different route that only takes me a half hour and that's going to reduce my stress and I'm going to feel like less out of control over my stress level and my route to work, that's a great thing to do. So sometimes thinking about what are the problems in my life that I can elicit change on. Um, Thinking about, and I'm going to throw up the stress management here so you guys can kind of look at that while I'm talking. Um, Assessing your priorities. Am I putting my energy into things that are meaningful to me or not? Are the things that are important to me getting the most of my attention or maybe not? And realigning that, right? Um, and then, of course, I always feel like I have to say, following up with your doctor, having those conversations that feel most meaningful to you, getting the information that you need. We know that having the information that you need makes you more engaged in your healthcare and a better decision maker. So that's a win-win in my book. Um, the other thing I want to say, just to go back to assess priorities, is, sometimes what your priorities were before the diagnosis are not the same after the diagnosis. Or maybe some of those priorities get clarified. I put a lot of emotional effort into my career. I put a lot of I spent a lot of time thinking about work when I wasn't at work, but my family is actually really important to me. And I need to figure out how to have a better work-life balance. Right? That could be an example. Okay. Now, if you're interested in healthy lifestyle changes, and I have to acknowledge, we changed the name of this and I didn't change the name of this. So we had a program called Weight Loss for Wellness. We now call it Food and Fitness because not everybody comes to us wanting to make healthy lifestyle changes in order to lose weight. Some people just want to get healthier. Or sometimes people are like focused on getting healthier, and if weight loss happens, great, but that's not the primary goal. So food and fitness, wherever you see weight loss for illness, just think food and fitness. We've got a new group starting in the new year, co-facilitated by an oncology dietitian and a mental health professional to come at it from both an information standpoint and a behavior change standpoint to talk about and provide support around making healthy lifestyle changes related to food and physical activity. So if that's something that you're wanting to do, want to jumpstart doing, maybe feel like you need information, maybe feel like you need the moral support and need a buddy in that, highly recommend this program. There's even a graduate group, so after you go through it, you can keep getting ongoing monthly support from other people who've been through the program as well. Okay, final strategy here. And let me see. I'm going to throw up one more last poll here of our day together of just asking, where you feel like maybe you've already made some changes to sort of increase that internal sense of control. So, final strategy for empowerment, dual. One is hopefulness. How can I start to tuning in to those cues of safety, those cues that say things are okay enough versus the negativity bias that we come wired with, which is like looking for dangers. Can I start being more intentional about finding things to feel hopeful about? And finding space to share your sadness, to share your anger, to share your fear and not have to be alone with it, right? It's not toxic positivity. It's not about just being hopeful all of the time because that's not realistic. What's realistic is to find times that you're feeling hopeful and to realize there's times when you're going to feel some of those messier emotions as part of what you've been through. So we want to both we want to acknowledge, manage, anticipate triggers, which is something in our environment that causes us to think about the cancer experience. And we also want to cultivate hope. So there's lots of common triggers. Some we can anticipate, anniversary of diagnosis, going in for scans, right? There's now more and more research coming out about scanxiety, birthdays, right? Those mile markers can be holidays, can be times that we get triggered. There's also things that we can't anticipate. We find out somebody we know has cancer. October, most people I know that have breast cancer, I shouldn't say most people, many people that I've encountered that have breast cancer, October is like, do I turn the radio on or not? Because I can be jamming out to one of my favorite songs, and then I wasn't thinking about cancer at all. And now all of a sudden they're talking about the Avon Walk, or they're talking about, how the Chicago Bears are wearing pink at their game. And now all of a sudden I'm thinking about cancer again, and I wasn't thinking about cancer before, but now thank you very much. Now I'm thinking about my diagnosis. Can't control that, right? Can't control if you find out about somebody else who had a recurrence or maybe somebody died, whether you know them or not. Maybe it's a famous person, right? Like I think about, I was running a group, I think when Chadwick Bosworth died. He was a famous actor who died of colon cancer. He didn't really talk publicly about his diagnosis, so I think there was some shock around that too. Threw many of my group members for a loop of how they were impacted by that, right? And so sometimes we can't anticipate the trigger. When we can, then maybe we take extra steps to like be gentle with ourselves, do some more stress management, put some plan in place to take extra care of ourselves. If we can anticipate it and it comes up, to recognize it, to acknowledge it. Oh my God, this really impacted me to hear about this celebrity, or it really rocked my world that I was having headaches because you know what, even that was one of the first things that triggered me to go to the doctor. And then I didn't even have cancer that was in my brain, but then that's how they found out I had cancer, right? So that you can both articulate that and then also think about, what do I need to do to take extra care of myself because this understandable trigger popped up and now I'm back in that headspace, reeling and thinking about my diagnosis, reeling and feeling those emotions related to my diagnosis again. Now, cultivating hope, psychologically, hope is knowing what you want to achieve and having the willpower and the way power to achieve that. Willpower is that gas in the tank. Way power is like, I know how to do what I want to do, what I want to achieve. Now, there are like concrete goals that we could talk about, like I want to clean up my yard before it snows, right? Um, that's one type of goal. I'm actually talking about goals that are more value-based. So goals that I call them toilet paper goals. So even before COVID, I hate buying toilet paper. I don't know why. I've always hated toilet paper. I just want to go to the store. I want to buy one roll of toilet paper. I want it to never run out again. But what happens? I don't know about you, even if I go to Costco, sooner or later the toilet paper rolls out, and I have to buy more toilet paper, right? There's some things that we're just always going to constantly be working on and working to achieve, right? Just like buying toilet paper. There's certain goals. It's like humor is really important to me in my relationship with my spouse, right? I don't share a joke with him once and say, well, that's all wrapped up. We're done with that goal. Check that off, right? I'm constantly feeding that to have there be humor in our relationship, to have there be laughter in our relationship together. And when I'm able to cultivate that, I feel good. I feel hopeful about our relationship. I feel positive about our relationship. I feel like the things that are important to me are being reflected in my life. Those are the goals I'm talking about. During cancer, it is very typical to move all the goals, all the hopes into one basket, and that's the physical basket. And maybe there's some remnants in the other baskets of the areas of your life that are important to you, your family, your friends, your spiritual life, your work life, community involvement, right? Got all these different areas of our life. It's very typical to just put all of the eggs in that physical basket. But what can help with cultivating hope is taking a look to all those other baskets that you used to have hopes about, that continue to be important to you, that you continue to have an idea of this is what I want to do in that area to live my to live my best life, right? And to think about diversifying the areas of your life that you have hopes in. That doesn't mean that you're not tending to your physical well-being. That doesn't mean that you're trying to cultivate hope around your health, right? Like cultivating your hope around your health may be, you know what, I'm going to really try to eat health. I'm going to eat healthier because that's going to make me feel like I'm doing something to help my physical well-being. And you know, I really love one of my pastimes is art. I love being creative. I really value being creative, and I haven't been doing any of my projects. I put my embroidery down and haven't been doing it. I'm going to pick that up and start doing that again, because when I do that, it feeds something that's really important to me, which is being creative, right? Those are the kind of goals that I'm talking about. If you're interested in more information about this, like looking up value-based goals, um, acceptance and commitment therapy is something that really relies heavily on that notion of value-based goals. If you're interested and intrigued, I'm just giving an introduction here, but that could be a pathway to get more information about hope. Okay, now, um, the thing that is wonderful is that more people than ever are living with a cancer diagnosis. And in some ways that sounds horrible, like, oh my God, more people than ever are living with a cancer diagnosis. More people are surviving a cancer diagnosis. More people are living longer with and after a cancer diagnosis. So even from a medical scientific perspective, the amount of hope and scientific discovery. When I started doing the multiple myeloma group about 12 years ago, there was like 3 treatments. I don't even know how many treatments there are now, right? The expansion of knowledge, even that alone, I think can be sometimes a source of hope. And I hope that you too are able to find things, not just medically, but also in your life, to help you feel hopeful as well. So with that, I want to thank you all for being here. I know there were a lot of questions in the chat, and I'm going to stay here with you guys to answer those questions. But I understand if you need to drop off at this point. So if there's anything that you need or want to follow up with, if you can't stay for that Q&A part of it or the chat question part of it, please feel free to reach out to me. I'm happy to address any questions or talk to you further about any of the topics that I talked about here.
Thank you, Priscilla. Let's go over some of the comments and questions in the chat. I think some
Sure.
of them were useful for other people to hear if they weren't reading along in the chat. Let's see.
I'm
One
going to
person.
stop. Wait, I'm going to stop
Oh, sorry.
share. No, that's okay. I just have to figure out how. There we go.
There
Okay.
you are.
Hi.
Hi. So one person said, I prefer to think of myself as surviving, not a
Mhm.
survivor, but surviving. And then another person chimed in and said, I say thriver.
Yeah. Yeah. So those are definitely terms that have come up before. The idea of being a thriver or being in thrivership. Again, I think it's thinking about what language feels comfortable for you is part of it. I hope feeling permission, if you don't like the word survivor, to at least give yourself permission to say, like, yeah, I don't like that word, and it's okay if I don't like that word. And then I think there's another aspect of it as well, which is, if people are using language to describe you, especially in your personal life or even your professional life, and you don't like it, to feel empowered to say something to them, to say, I really don't identify with that word. I appreciate that word may work for you, but it doesn't work for me. Um, and then when I hear it, it makes it hard for me to hear what comes next. You know, that's just an example of, if it can help you advocate for yourself or communicate to other people what feels better for you. Because language can be very powerful, but I've certainly heard the word thriver before. Yeah. Yeah, that's a great word.
Here's another comment I'm sure can resonate with a lot of people. One thing I didn't expect nor even thought about was how lost I felt after my treatment was over. It was so routine to go to the radiation every day, and then it was over, and I was like, what am I supposed to do now? It is just done.
Yeah. Well, and I want to say, especially with radiation, for those of you who went through radiation, that is such an intense routine every day for weeks on end. I mean, you get the weekends off, but like literally your entire schedule is built around this. And you're like dealing with like cumulative effects of the radiation. That I think that notion of you're provided this routine, and it's not a routine you want to be in, right? Like nobody's like, oh, pick me for chemo, pick me for radiation. So I think it can also be really confusing to get to the end of something that like you want to get to that finish line and then you get to it and it doesn't feel as good as you thought it was going to feel. Like maybe you don't exactly know how to like recalibrate what your routine should be after that. You might not feel up to going back to your old routine, like especially if you're working and you got some like dispensation to adjust your schedule while you were in radiation, and then you end radiation and that's when you feel crappy, and excuse my French, and then you're expected to go back to your regular routine at work. Like if you really pause and you think about it, like how unrealistic that is to expect of yourself. And I think thinking about granting yourself grace, as well as the acknowledgement that it's common to feel disoriented and to feel a sense of loss, even around something that you maybe didn't want to do, but that gave some structure and some like a frame around the cancer diagnosis and what you were doing about the cancer diagnosis, like that falls away when you're done with treatment. So whoever that was, thank you for sharing, because I think it's a perfect example.
Next, we had somebody ask, how do I treat neuropathy?
Ooh. So I'm not a medical professional, so I can't really give advice around specific side effects. I will say neuropathy is such a tricky thing. It has such an impact on quality of life. It's what, in my experience, I found is it's often a cumulative side effect, meaning the longer you're in treatment, the worse it gets. I've also had people I've worked with where they never even had neuropathy until after treatment ended, which is like I'm done with treatment and now this is happening. I definitely would encourage you, if you're dealing with neuropathy or any side effect that is having quality of life impact, to reach out to your healthcare team. Don't just tell them that you're having a side effect, paint them a picture. Help them understand how bad it is. Like I've had people like they're big tennis players, they can't play tennis. I've had people who like it's in their feet and they can't drive. I like to use thinking about diarrhea. Two people come in, they both say they have diarrhea. One person's having loose stools, one person can't leave the house because they're not sure if they can control their bowels. Both people go to the doctor and just say, I'm having diarrhea. How is the doctor supposed to discern how the level of responsivity they need to have, the level of intervention they need to have? So making sure that your healthcare team understands how much it is causing you to alter your day-to-day life. Um, I don't know how available, there's palliative care, which is really just about like quality of life, symptom management. I don't know if you're done with treatment, how available that would be. Specific to neuropathy, I certainly have had people that have ended up seeing a neurologist to get more specialized care because it was having such an impact on them. I can't give specific um, advice around that beyond sort of really talk to your healthcare team and help them understand how it's impacting your life, your lifestyle, your quality of life, your mental well-being.
Thank you.
Yeah.
Someone else commented, what is the word for more than exhausted?
Yeah, so I'm gonna put that through my little Google Cancer Priscilla translator. And what I hear in that is, how do I get people to understand that when I say I'm tired, it is not the same thing as not getting enough sleep. It is not the same thing as getting old. It is not the same thing as having a really hard workout, that it is a next level fatigue, right? It is, I have had over the years multiple people tell me about the times they've went to the grocery store and abandoned the cart because they hit a wall and they just couldn't. Like literally pushed the shopping cart to the front of the store and got in their car, right? So, I think there's the element of coping physically with the fatigue and what can be done about that fatigue. And that I would kick to the healthcare team. What I hear in that is like, how do I get people to understand that this isn't necessarily about getting more sleep. This isn't about if I just muscle through. Um, that's a difficult thing. I think, um, hopefully maybe I've given you maybe some ideas if what I'm saying resonates with you or with you as the person who wrote this, to think about what language can I use with the people in my life, even with myself, to recognize like cancer fatigue is in its own classification. It is not always easily translatable to other types of fatigue, that the comparison by others or even for yourself to other types of fatigue is not always going to be equivalent. And I think that's where that patience comes in. I think also when you're dealing with fatigue, I will talk to people about, in some ways, like that prioritization of what is important to me for my well-being, and am I saving that for the last? Am I putting that at the bottom of the to-do list? So I'm expending what energy I have, and then on things like cleaning the toilet. I mean, yes, we got to clean our toilet, but like metaphorically, I'm spending all my energy, all my widgets of energy on to do things, and I don't have anything left over to feed and nourish my soul, my spirits, my emotional well-being. I think that can be really meaningful to bump some of those things up the list. As well as if you notice that fatigue hits you at a certain time of day, being mindful of that as you're building in your routine. I know that at 3 o'clock, my energy sort of bottoms out. So how do I plan my day, my routine, so that when 3 o'clock rolls around, I'm not going to feel dejected when I hit that wall. Um, if you're dealing with fatigue, thinking about if you've got those things coming up that you really want to have energy for, is there a way to rearrange like your weekly schedule? So, or even your daily schedule. So like, I really want to go to that dinner out with my friends, but normally in the evening, I'm really tired. So I'm going to cool it with the to-do list for earlier in the day. I'm going to take a nap, or I'm going to rest, so that hopefully I can maintain some of that energy level. I hope that addressed in some way I, I'm making some assumptions based on how I've heard fatigue talked about before. So if that doesn't overlap your experience, apologies. If I'm not hitting on an important element of it, please follow up in the chat, and I'm happy to return to it.
The last two comments are somewhat related, and
Sure.
then we'll wrap up after this. I'm gonna read them both.
Yeah.
I've been so surprised on how much I've had conflicting feelings. I feel like most people assume, myself included, that you are so happy and relieved now that treatment is over.
Mhm.
Then, piggybacking off of that, I've tended to just not discuss what I'm going through with anyone who doesn't need to know, because I've found people uninitiated to cancer simply don't have anything helpful to contribute to my navigating this disease, and often instead say or do the wrong thing, even out of the goodness of their hearts. I have no energy for this.
Yeah. Yeah. So yeah, it's if you I mean, I'm gonna go back to what I said earlier. If you have not seen Inside Out, I mean, I love both of them, but and truly, every therapist I talk to about Inside Out, we're all like, we love that movie, because it really it deals with how complex it is to have these competing emotions and have them simultaneously, and then try to make sense of that. Um, and that's a hard part of it. Um, and the reality that, like, you not you don't have, nobody says you don't have to feel grateful and relieved. Right? I think sometimes when we put pressure on ourselves to have a certain feeling, um, it it emotions are like a spring, right? And so the more that we try to push certain emotions away, the more power that we give them. And sometimes allowing ourselves to just recognize and be where we're at, um, takes away some of that pressure, so that we create more space and we leave more energy to have those different experiences that may include gratitude and relief, or may include joy and happiness. Um, so I think that is one piece of it. It just occurred to me as that you were reading that second comment, Lisa, of, when you have people in your life that you don't feel like they get it, you don't have the energy to be like, you don't want to be their educator, you don't want to have to explain yourself, right? Like that can be really exhausting to do. I'll put a pit stop to say, like, sometimes there's relationships where, like, it is valuable, or it becomes like the need to maintain that relationship and maintain it in an honest way starts to outweigh the, like, energy it would take to do, like, have that sit down conversation. I will say what ran through my head as you were reading that, Lisa, is thinking about this from a grief model is I work with bereavement. And one of the things that's very common in bereavement is people have their existing social network and then they need to make new friends. They need to expand their social network of people to include others who have went through or are going through the same thing. And I would think of it like, just to make an analogy, is like if you're somebody who's had a child, and I'll use the example of a mother, right? Like when I had my daughter, what did I do? I went and I started going to story time so that I could meet other moms who had other little kids that are around the same age as me. Um, and so thinking about, do I have people in my social network who have went through something similar to me? And if the answer is no, considering being a part of an activity or a group, or finding even a person who you have a shared experience with. Now, we have support groups here, and that is emphasis on emotional processing, definitely talking about the breadth of the cancer experience, both the joys that can come, as well as the really difficult, challenging aspects of it that are difficult to talk about. We have a lot of other opportunities here at the center. We have groups that are like more social activity, where you might not be getting into the nitty gritty of it, but you just know that everybody there gets it. Everybody there has been through a cancer diagnosis, right? Like we've got things like canasta and mahjong. We do hikes. We have a knitting program. We have expressive arts programming. We have yoga classes, right? Lots of opportunities to be in community with other people. In my experience, people, the individuals that receive support from others who understand the cancer experience, that allows them to maintain and carve out space for relationships with people who don't. And for the people who don't, that can sometimes involve setting boundaries. What's really helpful for me, when I'm out, I want to be doing this. I love going out to lunch. And when I'm out to lunch, I really don't want to talk about the diagnosis, because this really helps me cope, is to have this space. What really helps me is hearing about how other people are doing. How are you doing? Right? That kind of boundary. I mean, that's a soft boundary. You could set a hard boundary too and say, you know what? Honestly, I'm not looking for any advice right now. I appreciate what you're trying to do. I really go to my healthcare team. So I'm going to ask you respectfully, can we change the subject, right? That's a more firmer boundary. But I think when you've got that crew of people that you feel like I can go to them, I don't have to explain it, I can be myself, that can help counterbalance the people in your life that, like, there just may be a limit to their empathy, a limit to their knowledge or understanding, that you're not really interested in getting into with them. Yeah. How do we do with the questions? Did
Well,
I
there's
answer?
one more that came in. I'll leave it up to you if you need to cut time
Oh,
or.
go ahead. Oh, yeah, no,
Okay,
I'm good. And thank you for those of you who stuck with me. I appreciate it.
my apologies if you can hear my dog in the background. Here's the comment.
Oh, there we go.
Came from gratitude to now dealing with fears as treatment has ended. My cancer is very rare, the subtype is rare, and there is very little information on it. Taking care of my emotions is a full-time job.
So what I'm picking up on is there's a bit of an information vacuum because there's not a lot known. So you're having inherently to deal with a lot of uncertainty. And certainly uncertainty and exercise and how to relate to uncertainty is a part of the cancer journey, but it is made even more difficult when there's a lack of information and also likely a lack of finding other people to connect with that are going through the same medical journey. So I mean, I think I want to start by acknowledging that. I'm going to open my chat because I just want to reread this. Um, you know, I'll just tell you what's coming up for me as I reread that comment is I think that there is a lot, there can be a lot of emphasis on the idea of being grateful. And I think that is it a self expectation? And I think that also gets communicated in our culture. It gets communicated by other people. I think there's a subtle way that even healthcare partners can communicate that. Um, it being like, well, you had a good result, right? Like it's so great. We found that treatment and it worked, right? Right. The idea of like, right, yep, I'm just happy about that. And when I hear of like I was in gratitude and now I'm in fear, um, it makes me wonder how much of an emphasis there's been on really focusing on being grateful to the exclusion of recognizing the nuances of that experience. And I think that's where that emotional spring comes out because cancer, uncertainty, lack of information, right? That's all a circumstance that would understandably cause anxiety that deserves finding ways to manage the anxiety. Um, so I think if finding that balance and finding that you're swinging like this, because it's normal to like swing and flow back and forth. And that's what we want, right? We want there to be able to be a flexibility and a movement in between different emotional states, right? And maybe sometimes you stay in one place for a little longer than the other, but there's a sense of an ebb and flow of your emotional experience. But if it feels like what you're doing is this, right? You just keep jarring back and forth, and it's sort of more rigid. I get there and I stay there. I can be in this really grateful place, and I'm really focused on gratitude and my blessings, and I'm feeling positive. And then I move over here, and now all I can feel is how overwhelming it is to like not know and sit with this uncertainty and what's going to happen. And I'm so afraid of what's going to come next. I think that's where I think coming and talking to somebody, if you don't have a group or you don't have a therapist, tapping into some of those support services, um, because your poor little nervous system is not having that ability to weave in and out of different states. It's just getting shoved back and forth. And your emotions are shoving you back and forth, right? You've got gratitude on one side and fear on the other side, and they're both like schoolyard bullies, and you're this poor little first grader with two fifth graders shoving you back and forth on the playground at recess. And I think, whether it be that group of friends that comes to that kid and says, you leave our friend alone, right? That support group that comes along and offers a buffer, or it's that, the teacher that's the the recess monitor that comes and says, okay, let's break this up. What's going on here, right? That therapist person that comes and breaks it up, I think can be helpful at finding more equanimity, because both of those emotions are part of the experience. We just want you to be able to weave in and out of that and not feel stuck in one place or the other. So I hope that responded.
Thank you.
Yeah. Again, thank you guys for sticking with me. Such wonderful questions. I'm so glad so many of you made it here today. I hope that the presentation and my answers to the follow-up questions were helpful. If there's any sort of like hanging chads out there for you, you've got my contact information. I regularly have at least a handful of people that reach out to me afterwards that have a follow-up question for me about something. So don't be shy if that's the case. I'll also be getting Lisa a copy of the slides from today so that she'll forward you along with the link to the recording. For the person who said, I've got a bunch of people and they're well-meaning, but they don't get it, maybe their holiday gift is a link to the YouTube. So if you don't have to tell them, I will tell them for you. So thank you, everybody.
Thanks, Priscilla. Thank you,
Yeah.
everyone.
Take it easy. Happy holidays, everybody.